Do you often notice a small bump or sore on your skin after playing with a kitten? Maybe your lymph nodes under your arm or neck feel swollen and tender. That could be more than just a bug bite. It might be cat scratch disease. It's common in kids and young adults who love cats, especially kittens. Think about it. Have you ever been scratched or bitten by a cat and then felt a little off a week or two later? That's the kind of situation where this condition shows up. It's not usually serious, but if ignored, it can cause longer problems. So, understanding it early helps you avoid worry and get better fast. So what causes cat scratch disease? It's not the scratch itself. That's the main problem. It's a tiny germ called Bartonella Lymphadenitis. Imagine this fleas bite a cat and spread this germ into its blood. The cat doesn't get sick, but the germs stay in its body, especially under its claws and in its saliva. When a cat licks its paws or scratches, you even lightly, those germs can enter your skin. Example, let's say you're playing with a cute stray kitten and it scratches your hand. You don't bleed much, but 2 days later, a small red bump forms right where the scratch was. That's often the first sign of the germ setting in. So it's not that cats are bad, it's just that they can carry something we're more sensitive to. How do you know if it's cat scratch disease and not something else? Let's play detective. A week or two after a cat scratch, you might notice a small raised bump that looks like an insect bite at the scratch site, but it doesn't go away. Then the lymph nodes near that area, like under your arm or around your neck, start swelling and feel sore when touched. You might feel tired, have a mild fever, or even a headache. Real-life case. Imagine a 10-year-old girl who loves petting cats at animal shelters. After petting a lively kitten, she got a small scratch on her hand. A week later, the lymph node in her armpit swells up, and she feels unusually tired. Her mom thinks it's the flu, but it's actually cat scratch disease. The symptoms can be mild, but if they last more than a few weeks, it's time to see a doctor. How do doctors know it's cat scratch disease? They can't always tell just by looking. First, they'll ask about your contact with cats and check the swollen lymph nodes. They might gently press on them to see if it's painful. That's a clue. Sometimes they'll take a blood test to look for antibodies against Bartonella. Another method is a PCR test, which checks for the germs, DNA, and the lymph node fluid. In most cases, especially mild ones, you don't need treatment. Your body fights it off on its own, like a common cold. But if the swelling is painful or lasts too long, the doctor might prescribe antibiotics like azithromycin to speed things up. Think of it like using a boost button in a video game. The win was possible without it, but the boost makes it faster. Can you still love cats and avoid this disease? Absolutely, you just need smart habits. The key is stopping flea infestation on your cat, because fleas spread the Bartonella germ. Use flea collars or vet-approved flea treatments. Also, avoid rough play with cats. No pulling tails or letting them scratch your face. If you do get scratched, wash it right away with soap and water. Example, you're babysitting and the family cat gets excited. Instead of letting it jump on your arms, use toys to play from a distance. And always wash your hands after handling cats, especially before eating. Teaching kids these simple steps is like giving them a tiny shield against illness. Scientists are working to understand cat scratch disease better. Recent studies show that some people, especially those with weak immune systems, might have more serious reactions, like prolonged fever or eye infections, from Bartonella. New blood tests are being developed to detect the germ faster and more accurately. In 2023, researchers used genetic sequencing to track how the germ spreads in different cat populations. This helps us know which environments have higher risks. Another cool advance, some labs are exploring vaccines for cats to stop Bartonella entirely, like how we vaccinate dogs for rabies. While it's not ready yet, this could one day protect both cats and humans. So the future looks promising, fewer surprises and more safe cuddles.